Hello, my name is Dustin Anderson. Today I'm going to be talking to you about the apprehension test. Currently, I'm a student in the Doctorate in Athletic Training program at Indiana State University. Um, so the apprehension test, one thing I really like about this test is it's quick and easy to administer. It doesn't take much for the practitioner to do this test. You just need a table and or you can do this test with the patient standing up, as we'll see as we go along. But it's been found to be specific in identifying shoulder instability issues. Um, One thing that you can do with this tool that it may be sort of a novel idea or something you've probably not thought of, is using it as a screening tool in a pre-participation exam, especially for sports that require overhead motions like baseball, softball, volleyball, lacrosse. It can be really good in as a screening tool to see if the athletes are having any type of shoulder issues before they go into the season. It's not a definitive tool, but if there is some apprehension with them making the motions of this test, it leads the clinician down that road of, oh, something may be going on. Let's take a bigger look at this, because if they can't put their arm in this position, how can they participate in their sports without any pain? Um, Sort of the procedure for this, the patient can be either standing or supine, as you can see with the two pictures. Like I said, it's a pretty easy test to administer. You would just need a place to do the test and a means to record it. You can also use this as a base. Say if you're working with a baseball team and no one has this test isn't positive, you can write that down and you can use that as a baseline when they come in. And it could also be a clearing tool because they didn't have it before. They had a positive test, and one would believe with good rehabilitation and everything else, like they wouldn't have it at the end. So again, the patient is either standing or supine. The examiner stands behind or at the involved side of the patient. Then the examiner grasps the wrist with one hand and maximally externally rotates the humerus with the shoulder at 9 degrees of abduction. That can be standing or supine. Forward pressure is then applied to the posterior aspect of the humeral head by either the examiner if the patient is standing or the table if the patient is supine. This is a positive test for anterior instability, and like I said, the positive signs is if they don't want to put their arm in that position where their humerus and their shoulder has 90 degrees of abduction. Again, it's just a good, quick screening tool that clinicians can use, and I think it would be beneficial to put it into clinical practice.